Painful menstrual cramps are one of the top female cycle issues that I see in clinic, and it can be severe enough to induce a feeling of absolute dread and anticipation of the pain each month in some women. I'll review 5 treatment strategy tips to help you deal with menstrual cramps at home in today's video. Well, what's up, healthy people? I'm Dr. Majd, a practicing family medicine physician in San Diego, here to help save the busy person an unnecessary visit to the doctor. Make sure to subscribe for more home treatment strategies for common medical conditions for you and your family. Here we go. Tip number 1, apply heat. Studies show that heat therapy can be effective for the treatment of menstrual cramps. Invest in a small heating pad to apply to the area of the pain, or alternatively, you can wet a small towel and place it in the microwave for a few seconds, but be very careful not to overheat and burn your skin. Tip number 2, anti-inflammatories. Here's a trick that's worked well for some of my patients. Track your period on a calendar. And if you can anticipate when the first day of your pain typically begins each month, you can take ibuprofen 600 or 800 milligrams 3 times a day and only with food around the clock starting 1 day prior to the onset of the pain and continue it for the number of days that the pain typically lasts. Now, not everyone can take anti-inflammatories, however, so make sure to clear it by your doctor first. Tip number 3, exercise has also been shown to diminish menstrual cramps and menstrual symptoms in studies, believe it or not. Aim for 30 minutes of cardiovascular exercise where your heart beats fast and you break into a sweat on most days of the week. Yoga in particular has also been shown to be helpful. Tip number 4, your diet, what you consume. Interestingly, a low-fat vegetarian diet has been shown to diminish the severity and duration of menstrual cramps. 3 to 4 servings of dairy a day have also been reported to reduce symptoms. Number 5, vitamins. Now, there are some small studies that indicate that vitamin E may be more effective than placebo when taken at 500 units per day or 200 units twice per day, beginning 2 days before the onset of your period and continuing through the first 3 days of bleeding. Other small trials have also indicated a possible role for vitamin B1, B6, and fish oil, although the jury is still out on all of these. Now, if these tips do not provide enough relief for you, hormonal contraceptives are the top prescribed treatment for menstrual cramps, but it will require a visit to your doctor. So what's worked well for you to control your menstrual cramps? Share it with us in the comments below. Now, if you found the information useful, let me know by giving it a thumbs up and share it with someone else who may find it useful. And don't forget to hit that subscribe button and that bell next to it in order to learn more useful, actionable health tips for the busy person who can't always make it to the doctor's office. I'll also place a link to my website and social media channels in the description for this video down below. Now, all content presented is for informational purposes only. It's not specific medical advice, and you should always seek a licensed physician in your area for all health-related concerns. Well, thanks for tuning in. Stay healthy, and I'll catch you next time.